How do I know what's, type of testing I need if even the main agency tasked with enforcing it can't tell me what it means? So it's a problem. And especially when we start seeing products with newer ingredients that haven't been typically used in the past.
Hello, and welcome to FDA Watch. I'm Wayne Pines, and I've been involved with the FDA in one way or another for several decades, never in such a tumultuous time, but I was an associate commissioner at FDA when there were major changes, and over the years I've authored or edited 16 books about the agency.
And I'm Shelly Garg, and I'm the managing partner and founder of Garg Law, a full-service FDA-focused law firm. I have been on the private side advising companies on regulatory compliance and enforcement for more than 15 years.
By now, if you subscribe to FDA Watch, you know what to expect from us. We're an independent, nonpartisan national forum for discussing the latest developments, trends, and issues surrounding FDA.
And if you haven't subscribed yet, do so today at fdawatch.net. You'll be the first to receive an email when a new episode drops, including bonus episodes when there's breaking news. Plus, you'll get quick access to our headlines and resource links, as well as some background about our guests.
In this episode, we'll focus on cosmetics compliance and enforcement. We have an outstanding guest to help us discuss these very important topics. You'll meet him in just a moment.
But first, let's get to some headlines.
Of course, the big news is that there are cutbacks in the FDA staff, and there's also a new commissioner at the head of the agency. Dr. Makary, who is taking over as commissioner, certainly has a very challenging agenda ahead of him. We'll be talking about these developments today and in future podcasts. In addition to these mega matters, there are a few interesting things that we should be aware of. For example, from our Pharma desk, FDA will not require an advisory committee meeting for a new fibromyalgia treatment. And the importance of this is that the FDA is developing new policies with regard to when they require advisory committee meetings. There have been reports that they want to cut back. That started pre this administration, but they've tried to cut back on the number of AdComs. And some of the new leaders in the health area that are coming into the agency and coming into HHS have expressed reservations about the use of advisory committees. We'll be watching this as we move forward with regard to the specific fibromyalgia advisory committee. The drug received fast track designation in 2024, and avoiding the advisory committee meeting helps to further its accelerated path toward approval. From the device desk, there's an advocacy group that says that FDA should regulate dangerous, and that's their word, dangerous prescription software platforms as a medical device. Rhode Island's Doctor-Patient Forum petitioned the FDA to classify and regulate a proprietary risk scoring algorithm as software as a medical device. The petition says that the company offers healthcare providers with access to data to prevent opioid abuse, but according to Doctor-Patient Forum, the risk scores coerce healthcare providers into making clinical decisions based on undisclosed algorithms rather than individualized patient assessments. We talked at length about software as a medical device in our episode with Jennifer Newberger and Michael Gabe in March. So we encourage you to check that out for insights into how software is being regulated by FDA in the device space.
Thanks, Wayne. From the Foods Desk, FDA pushes back the compliance date of the Food Safety Modernization Act, FSMA, Section 204D. The compliance date's timeline was previously set for January 20th, 2026, but it's now set for July 20th, 2028. Industry groups, including the Food Industry Association and the National Grocers Association, stated their support of the ruling, citing complex requirements and supply chain burdens resulting from compulsory compliance. According to an article from the Food Institute, quote, the food traceability final rules journey through the government has been arduous, end quote. Congress originally required the rule to be enacted as part of FSMA in 2010, then directed record-keeping requirements for high-risk foods by January 2013, according to Food Safety magazine. After failing to meet the deadline, the Center for Food Safety sued the agency, leading to the September 2020 finalization that mandated a process to be made by November 2022. The agency met the 2022 deadline and devised a comprehensive plan to require businesses to comply by 2026. However, FDA sanctioned the delay because it believes the industry is unfit for its implementation. From the cosmetics desk, beauty industry giants plead with the European Union to exclude American cosmetics from its tariff war. A group of cosmetic companies, such as industry giant L'Oreal, are hoping the EU will exclude American cosmetics when it rolls out its new set of tariffs. Products such as shampoos, perfumes, aftershaves, and sunscreens, among others, were included in the EU's 99-page list of retaliatory tariffs on U.S. goods released in March. L'Oreal CEO recently told the Financial Times, quote, if there is this tit for tat thing on beauty, it's going to penalize Europe much more than American businesses and companies, end quote. He added that he urged the officials he met in Brussels in March to look at the balance of trade before subjecting entire categories to tariffs. The CEO was joined by 15 other beauty executives in warning the EU that its tariff countermeasures could hurt their operations. We'll see how the EU responds to this, which could mean waiting to see the final list of retaliatory tariffs upon release. Now, Wayne, let's meet our guest.
Joining us today is Justin Prochnow. He's a partner in the Denver office of the law firm Greenberg Traurig. He works with companies in the food, beverage, supplement, and cosmetic and personal care products industries. You won't see his face on this podcast because we're a podcast, but Justin has been a recognized face and name in the industry for many years. We're excited to have him join us today. Welcome to FDA Watch, Justin.
Thank you. I appreciate being invited.
First question. We have a new commissioner at FDA, Marty Makary from Johns Hopkins. If you had his ear, what would you say to him in terms of how the agency is regulating cosmetics and what kinds of further activities the agency should undertake?
Well, Wayne, it's a good question. And I think at the top of everyone's mind is, what is the FDA going to do about MoCRA, the Modernization of Cosmetics Regulation Act, which went into effect in 2022. And there were all of these new developments that were going to occur in the regulation of cosmetics. And certainly everyone in the cosmetics and personal care products industry was looking at this very closely as companies started to get in compliance. And it's been kind of a staggered series of new requirements that have been put in place. And as of now, there's a couple elements that companies have to comply with. There's record keeping for serious adverse events, similar to dietary supplements. There is registration of facilities where products are manufactured. And there's listing of products and ingredients that all had to go into place last year. And so companies have started doing that. But there were these additional elements that were coming up, most notably GMPs for cosmetics. Amazingly, for all of these years, there have been no official or required good manufacturing practices. That's GMPs for those who don't do this on a daily basis. The GMPs are what manufacturers and other companies have to follow to manufacture compliant products. And we have those set in the food industry. As Shelly full well knows, I've worked with her on these types of things before. The GMPs for dietary supplements are well known, but there's never been any official GMPs for cosmetic products. And there's some tentative and suggested ones, but haven't been any full ones. And part of MoCRA was that FDA was going to come up with some new GMPs for companies, and that hasn't happened as of yet. And I think everyone is waiting anxiously to see whether the new administration is going to follow through with MoCRA, or whether that's going to be one of the number of other things that get put on hold with the new administration.
Thanks, Justin. I think that is obviously something that I encounter in my day-to-day practice with sort of the uncertainty. Can you talk about the main challenges that FDA faces in implementing MoCRA, especially in terms of resources or enforcement capabilities? And then also, how are you advising companies now to comply in this period of uncertainty? We've certainly advised that GMP, for example, is not an overnight task, and if and when the proposed rule and final rule becomes final, then companies would be ready to go. And there's certain international standards to follow that FDA has provided in terms of harmonization. So, can you just talk about kind of practical considerations, in FDA's implementation of MoCRA, and then just how companies can navigate this sort of uncertain time?
Sure. Well, obviously, you make life harder when you fire everyone at the agency that you're trying to then have enforce these rules. So if there's no one left to enforce them, it makes it much more difficult. And I say that somewhat facetiously, but I think we all know not so much either. It's a difficult proposition because they already are shorthanded. And now they're implementing new requirements with additional enforcement responsibilities. And you're going to have to train new people on enforcing those GMPs because, again, there are some tentative ones, but we don't really know whether those are going to be, there haven't been any proposed final GMPs. Are they going to be similar to those tentative proposed GMP? They're not even proposed GMPs, the recommended GMPs that have been in place for a number of years, or are they going to be significantly different? We don't know, but in the same way that companies are going to have to learn them, FDA personnel is going to have to learn them too. It's always been a requirement that companies manufacture safe products. So we still have that criteria or goal in mind whenever companies are manufacturing products, that they need to do safety testing to ensure it's compliant. But it is a little bit of a mystery as to what those additional requirements are really going to be. So using those recommended GMPs are at least a guideline for now, but it's a problem. And as you said, even when they do go into place, there's going to be a period of time for learning them and implementing them before they become required. So I think we're still a little bit of a ways off, but companies have certainly been kind of, truthfully, most of my clients, I think, are anxiously waiting, would just like to get them so they can start getting in compliance as opposed to continuing to wait to see what's actually going to happen or not.
Yeah. And one of the goals of MoCRA is to improve the safety of cosmetics, as we talked about. In addition to the enforcement, I guess, arm or capabilities of FDA, which remain sort of up in the air at the moment. What would you say are mechanisms that are in place to ensure companies follow through on their safety obligations, and how would violations be handled? I think part of this, Justin, is also, it's not just FDA compliance or enforcement, but it's also sort of consumer interest and where you're sitting on the shelf, retailer placement, then they have their own standards. But can you just comment sort of on what you're seeing in terms of, how to be ready, how to make sure companies are following through on their safety obligations when, again, the, MoCRA's enforcement still seems a bit loose, given the changes in staffing?
Yeah, I mean, it's a good question. It's one I get all the time from people like, I'm supposed to do testing of cosmetics, but what type of testing am I supposed to do? And if you go, the FDA actually has a page on its website entitled Product Testing of Cosmetics. And at least as of right now, the FDA would say, it says on that page, they don't have the legal authority to approve cosmetic products before they go to market. However, manufacturers are legally responsible for ensuring the safety. And then it says, so manufacturers need to ensure it. But when it comes to, well, what type of testing does that mean? the FDA basically says, we're not saying what type of testing needs to be done, but you
Right.
need to do whatever needs to be done in order to be safe.
Right.
So it's kind of a little bit of the, tail wagging the dog. Like, how do I know what's, type of testing I need if even the main agency tasked with enforcing it,
Yeah.
can't tell me what it means. So it's a problem. And especially when we start seeing, products with newer ingredients that maybe aren't, haven't been typically used in the past. I mean, again, Shelly and I run into this a lot in, both food products and supplements, where we continue to get, new ingredients from South America, or, new botanical ingredients that, maybe don't have established safety in the same way as others. And we know from this new administration that, they have a focus on safety. We're already talking about in the realm of food and supplements. Reviewing the GRAS process, and so
Right.
I would imagine we'll see something similar for cosmetics, and focusing on the safety of ingredients as much as anything else. So it's incumbent upon companies to do their own testing to ensure that they're going to be safe products. It's always been the case that cosmetics, just because of the nature that they're applied to the outside of the body, I mean, the FDA always traditionally has had maybe less concern over the severity of safety of cosmetic products as opposed to ingestible products, because more often than not, worst case scenario is you're going to get a rash or something else, as opposed to something that you consume that may even poison you to some extent. But I think there are focuses, and I think we'll probably talk about it more later. But I think there's a lot of focus these days on some of the environmental factors and cosmetics, and you're seeing not only FDA but individual states passing laws about some of the heavy metal contaminants and others. To me, that's, I think, where a lot of the focus on safety and cosmetics is going.
Yeah.
Justin, so we're here in April 2025. We have, as I mentioned at the top of our podcast, a number of changes occurring, some fundamental. Sitting here today, while the dust is still roused around and hasn't settled, what is your advice to your clients, your cosmetics clients, with regard to what they should be doing right now with regard to FDA and the evolving regulatory situation?
Well, certainly complying with the requirements that have already been implemented by MoCRA. So ensuring that if their manufacturer is registered with the FDA, that they have submitted their products and ingredients with the FDA as required. And right now, that's really the requirement. So the focus for me typically is always more on the packaging and what is being said, because look, we want to be compliant from a regulatory perspective. Of course, we hope all of our companies are good corporate citizens and comply with the FDA. But in this day and age, really, cosmetic companies are probably more susceptible to action from either independent states or our friends, the class action plaintiff lawyers, looking to take action for anything from labeling claims to, again, the environmental issues, Prop 65, all of those types of claims are really the bigger factor. So, taking care of those key FDA points, making sure we're watching what's happening, but more often than not, the focus of companies is more on ensuring that what they're saying is compliant and not going to run the risk of receiving some letter from a class action plaintiff lawyer.
Yeah. Thanks, Justin. We're going to take a quick break right now, but don't go anywhere because we will be right back.
And we're back. We're talking about cosmetics compliance and enforcement with Justin Prochnow. Shelly?
Justin, you talked about this before the break, but can you comment on, what are some of the biggest challenges that companies in the cosmetic and personal care products industry are seeing from class action plaintiff lawyers in the ad promo space?
Yeah, you bet. So I think one of the fundamental things, if we could step back just for a second, because I think it's helpful for those who maybe aren't in the cosmetic personal care industry on a daily basis, is the fundamental difference in what you can say about a cosmetic or personal care product and what you can say about a drug.
Yeah.
Because in the United States, topical products really can only be sold as one of two products. Non-drug topical products are classified as cosmetics, also known as personal care products, although the FDA really recognizes them as cosmetics, or drugs. In limited situations, you might potentially have a medical device that would be a topically applied, but for the most part, it's a cosmetic or a drug. And fundamentally, the difference is what you say about the product. The definition of a drug is a product that is intended to diagnose, treat, cure, or prevent a disease, or a product that's intended to affect the structure or function of the body outside of a dietary supplement. For cosmetics are articles that are rubbed, sprinkled, applied to the body that do one of four things: either cleanse, beautify, promote attractiveness, or alter the appearance of the skin, but not from actually affecting the skin, just from altering the look of it. And this is fundamentally the difference, and probably the number one issue when I have clients who come to me and say, hey, can you review our packaging, our labeling? Can you help us evaluate our claims? That is the fundamental difference between whether their product is a drug or whether it's a cosmetic, is what is the intended purpose on it. And so this really is the key factor to look at when companies are deciding, whether it's a compliant product or not, is, am I making claims that are appropriate for the type of product that I sell? So cosmetics are things like, it makes the skin look cleaner. It makes it look more beautiful. So your typical what you would think of as cosmetics. The part about affecting the structure, or the part about altering the appearance of the skin, really when the Federal Food, Drug, and Cosmetic Act came out and you had cosmetics, that was really thought of as more like a cover-up, like something that you put on blemishes so you can't really see them anymore. And now these days we have a lot of products who talk about put one or two dabs of this, serum on the skin, and all of a sudden now your dark spots or your, pigmentation fades away. Well, that's a drug in the eyes of the FDA, because it's not just altering the appearance from covering it up, but it's actually having an effect on the structure or function of the body. And I say this because this is really the important evaluation. So we see a lot of products that are creams, let's say like an inflammation cream or a pain relief cream. Pain relief or inflammation has nothing to do with cleansing, beautifying, promoting attractiveness, altering the appearance of the skin. I mean, that is a structure function claim. And in many cases, some would say even a claim it will diagnose, treat, cure, prevent a disease. So a pain relief or an inflammation cream equals drug. There's no way around it. A topically applied cream that does any of those types of things other than cleanse, beautify, promote attractiveness is a drug. And yet we see hundreds, if not thousands, of products out on the market for various types of relief that aren't sold as drugs. They're sold as, cosmetic, personal care, non-drug products with either insufficient knowledge that they're being sold non-compliantly, or just a belief that the FDA has other things to do and is not really going to take much action. And so from an FDA perspective, those are probably low risk. And so that is where the plaintiff lawyers or competitors come into play. And we see cease and desist letters, or we're seeing more and more letters from plaintiff lawyers now saying, you are selling a unapproved drug because you are making claims this will diagnose, treat, cure, prevent a disease or affect the structure or function of the body, but it's not registered with the FDA as a drug. You don't have drug facts on there. It's not compliant with the drug. So you're selling an illegal product. And that is probably the biggest risk we are seeing from companies these days, at least from the quasi-regulatory perspective. And then we can talk about it. I'll pause there for a second, but claims, of course, are the other big area. Everything from all natural to organic to paraben free. That's the other kind of area where we see a ton of action from plaintiff lawyers.
Thanks, Justin. Just a question on what you just stated. I mean, are there any sort of drug disease claims that are borderline, uh, you know, um, risky? It's just sort of as a category that are being targeted more by plaintiffs' attorneys. Certainly what I typically see as inflammation claims are obviously always borderline and always of concern because there are monographs and other products that for which there's different pathways in a cosmetic. But can you just talk about that briefly? Just as a category of claims, what are ones that are sort of more higher risk than others?
Sure. Well, I think certainly any topical product that suggests that you will lose weight from it, which sounds maybe somewhat silly, but it happens a lot. And that's one category of products that certainly gets focused and actually brings into the conversation another agency that we haven't really talked about, which is, of course, the Federal Trade Commission, because the Federal Trade Commission regulates all advertising. And they are particularly they particularly scrutinize weight loss claims because up until very recently, with the advancements of GLP-1 and other peptides like semaglutide, there has been no magic pill or magic cream or magic underwear, which we've had, that you can wear to lose weight. Obviously, with the success of drugs containing semaglutides or other types of peptide ingredients, it seems like there is kind of a magic, at least shot for these things. More and more companies are mentioning things like GLP-1. We're seeing that even in creams, a GLP-1 support cream, to help you lose weight. Well, again, that has absolutely nothing to do with cleansing. I mean, I suppose you could make the argument beautifying, promoting attractiveness, but, realistically, weight loss doesn't fall into that category. So weight loss is always going to be one. I would say the other is getting rid of any sort of skin issue, whether it's sunspots, wrinkles, cellulite. Those have always been a focus and target of both the FDA as well as plaintiff lawyers and, truthfully, competitors. Because if competitors believe that they're trying to follow the law and you're making claims that they would like to make but don't make because they know they're not compliant, that's where you're going to see the letter from the competitors saying, if we can't do it, we certainly don't think you should be able to do it either.
Yeah.
Justin, let me shift gears for one last question. Has to do with environmental sustainability. You mentioned before Prop 65, a lot of other initiatives going on. What are some of the biggest environmental issues that cosmetics and personal care products companies are facing?
Yeah, this is becoming one of the biggest areas. We do a lot of work with the Personal Care Products Association. One of my colleagues does a lot in the Prop 65 and heavy metals area. And this is a constant issue with cosmetic and personal care product companies, both large and small. A real focus on heavy metals. I mean, Prop 65 has always had that focus on heavy metals like lead, arsenic, cadmium, mercury. So Washington is just one example of a number of states that have taken action on this issue of various toxins and other components in products. And, Washington State addressed lead and the level of 1 parts per million. California passed a similar toxic-free cosmetic act listing, 14 plus chemicals that are not allowed to be in cosmetics. And we're starting to see, lots of different individual states passing these laws. We've had significant litigation over ingredients like silicon dioxide and other contaminants. And this has become a major issue for cosmetic products. We're also seeing, kind of the back and forth between organizations like the Cruelty Free. Everyone's seen the kind of the hopping bunny for the Cruelty Free logo. And I know recently FDA took the position that non-mineral sunscreens have to be animal tested, which obviously is directly not in compliance with the cruelty-free mantra. And so they've been pulling their logo from some of those companies that have the non-mineral sunscreens. And so again, trying to work through some of those issues, we're seeing more and more of these contaminant type of issues. Of course, PFAS, for those who are not familiar with that, are poly and polyfluoroalkyl substances. We see this litigation. I know, Shelly, you've seen it in the food and in the supplement industry, PFAS in packaging, even now PFAS in products. These are what some people refer to as the forever chemicals and forever plastics. My feeling is on a lot of these things, they've been around for a while. It's just that no one could test to the level that we can now to know that they're in there as much as they are. But now it's coming up, and we're seeing these types of actions, again, in everything from packaging to products. And so these types of PFAS, PFOS, and other of these types of chemicals are going to continue to be a major focus for companies moving forward.
Well, it's clear that there are a lot of issues facing the cosmetics industry, not just in terms of MoCRA and not just in terms of whatever resources FDA allocates to its implementation, but also in so many other areas. And thank you for an excellent summary of all of these issues. We're going to turn briefly now to our resource link segment, where we provide you with some valuable links that you might want to check out. So, Shelly, let's share them with our audience right now.
Will do, but I want to first point out that these links will be included on our website, fdawatch.net, so there is no need to write anything down.
From our pharma area, there's new data that shows that FDA drug approvals fell last year, but that up-and-coming companies made their presence known. According to an analysis from the data firm Global Data, drug approvals by FDA fell more than 15%, from 149 in 2023 to 126 in 2024. According to a late March article from the Pharma Letter, the report highlights that small players, small companies, continue to push the industry forward. Several of these small developers secured their first approvals in 2024. As the year progresses in 2025, we'll keep an eye on other new players getting their products through trials and on their way to market, as well as how approvals would fare under this new administration. Let's turn to our devices resource link. It's been available for some time now, but we thought it would be good to share a link, and you'll see it on fdawatch.net, a link to FDA's Idea Lab, which was created under the Home is a Healthcare Hub initiative. The Idea Lab was launched to help developers create new solutions, visualize how their medical devices may fit into the lifestyles and homes of people, as well as integrate well with other health technologies. These medical devices could serve purposes of prevention, diagnosis, treatment, rehabilitation, monitoring. The FDA chose people living with diabetes as a test case, given the prevalence and burden of the disease, as well as the importance of medical devices and lifestyle in managing diabetes and preventing comorbidities. Although the Ideal Labs focus is on diabetes, the Home is a Healthcare Hub initiative is intended to foster solutions supporting prevention, wellness, and management of a variety of chronic diseases and health conditions. And again, you can see the link at fdawatch.net.
Thanks, Wayne. Let's look at our foods link. FDA recently launched a new searchable online database that provides a consolidated list of contaminant levels used to evaluate potential health risks of contaminants in human foods. The Chemical Contaminants Transparency Tool, or CCT tool, includes contaminant guidance levels, tolerances, and action levels, which the agency uses to help minimize or prevent chemical hazards in food. The CCT tool is available through the FDA website and, of course, through our link at fdawatch.net. And finally, let's turn to our cosmetics link. On March 13th, FDA published summary data from mandatory registration of cosmetic product facilities and the listing of cosmetic products as required under MoCRA. As of January 1st, 2025, FDA has received 9,528 unique active facility registrations and 589,762 unique active product listings. If you are a cosmetic company subject to MoCRA, it is important to confirm you meet the registration and listing requirements. Again, this link and all of these links are available at fdawatch.net. And on that note, Wayne, it's time to thank Justin for being such an excellent guest on this episode. Thank you so much, Justin, for your time. We'd also like to thank our podcast creator and executive producer, Michael Levin-Epstein, and our assistant producer, Sam Hoffmeister.
And Shelly, this is important. If you want to suggest or be a guest on our show, or want to be a marketing partner or a sponsor, or just comment on the show, you can contact us directly at info@fdawatch.net. That's INFO at fdawatch.net. And definitely check out our website, fdawatch.net. Again, fdawatch.net. Finally, we'd appreciate, if you're so inclined, to give us a 5-star rating on Apple Podcasts, Spotify, wherever you get your podcasts. It really does make a difference. And remember to follow us and subscribe. Get all of your friends, your family, everybody you know to subscribe. That's the only way to make sure you won't miss a single episode of FDA Watch.
And as we say at the end of every episode of FDA Watch, if you really want to watch what FDA is doing, listen to FDA Watch.